morning, everyone. This is Michele Hughes from Ageless and Timeless. I do love that introduction because who wouldn't love to feel like they're just simply amazing all the time? And that's what Ageless and Timeless is all about, is feeling and being your very best, the best version of yourself. And all these amazing guests that we have on are able to give their point of view and their experiences that inspire you to take some of their information and their direction and their advice and use that in your own experience and your own journey. So today I'm very fortunate to have Debra Geihsler, a guest who I've been speaking with for quite a while. Her very close colleague is Dr. Dale Bredesen, who was on our podcast a week ago. And I hope you all caught that wonderful podcast. And we'll talk about Dr. Dale's protocol with Debra today. So welcome, Debra.
Thank you. I'm happy to be here.
Yeah, you're an amazing woman. We want to hear all about you. So why don't you tell us your journey? How did you go from Harvard to being involved with Dr. Bredesen and this wonderful new company that's going to grow so exponentially called Gray Matters?
Great. So as you know, I was a healthcare CEO, and I really felt like we were not paying enough attention to our patients and really wanting to make sure we could embrace our patients with their uniqueness and their opportunities. So I started my own company. It was called Activate Healthcare. And we really worked with employers directly to say, let's embrace the patient with their uniqueness and understand who they are, but actually get to know the patient and their whole comprehensive self and get to the root cause of what was driving their health issues. And through that process, and then I sold my company. It was a great company. We saved people a lot of money. We helped a lot of lives, and we had a lot of people see they improved their health. And through that organization, when I sold it, I was introduced to Dr. Bredesen. And the reason that Dr. Bredesen and I related so well together was he was doing the exact same thing, only he focused in on dementia. And he was focusing in on getting to the root cause of what is causing dementia and really saying, if we get to what that root cause is and fix that, we should be able to turn people around. And he's shown that results. And actually, we've seen that in our clinic. So I'm delighted to be Dr. Bredesen is part owner, founder with the clinic that we have where we take care of our patients. And I've learned a lot. As a healthcare CEO, you see the masses and you tend to talk to insurance companies. It's really hard to get to know the employers and the basic patient. So really getting to understand this disease has been very eye-opening for me as a former CEO.
You're taking the steps that MAHA is all about, which is to basically, and functional medicine, which is, Dr. Jeffrey Bland and all of the proteges that have followed him to basically look not at symptoms, but at the root cause of the illness. And secondly, and probably as importantly, to spend time with the patient.
Right.
Why is it that our healthcare system is so disabled?
Well, that's why I started my own company. Here's why it's disabled, because finances usually drives the business, right? I've been in healthcare a very long time. When we used to be community hospitals, we were nonprofit because we were supported the communities. But then we grew into specialists, very smart people, very smart providers who started dissecting every part of the body. And so we have a specialist for every part of the body, but we started to forget the whole person. And then we started to measure the success of that piece of that procedure. So if you go to the ER, they're going to say, we did all the right things for this disease. That may have not been all the right ththings for that individual, though. Because we forgot the person in the process. So because if you look at the electronic medical records and everything, they were designed for financial processes. How do you do your billing? How do you do your coding? How do you make the financials? So that's really what's driven the success of the health systems, is through insurance and billing. When you take that apart and you look at a quasi-functional medicine / look at the whole patient, you realize that if we actually provided comprehensive care to the patient, understood them better, why are these things happening, we could reduce a lot of visits and we could save a lot of pain for these patients by looking at them individually and what the causes are.
Well, we'll talk in a moment about how Gray Matters was formed and the concept and the mission. So in the meantime, though, before we get to that, just how do you feel that you can change that paradigm without the insurance, complement? Because obviously, insurance is a big part of why the system is run the way you just described.
Yeah, I think that they've been struggling for a long time trying to find value-based care. So I think they have wanted to do that. Yeah, remember also that, the primary care is really the population, the physician group that takes care of the whole patient. We've kind of skipped over that primary care person managing the whole patient and still are looking at value-based care in the way that quality is driven. So, but I think the insurance companies are striving, and as a matter of fact, Medicare just came up with a program called the Guide Program, which is encouraging people to have more involvement in the patient by some care management program. So I think that the trend is coming. It's really hard to change from a fee-for-service model to a value-based model. And it takes a lot of time, but you can see parts of it coming around. It'll happen. And then there's groups like my group. They got bought. They now have 700 clinics across the country. So there's groups that are working and understanding you put the patient in the center instead of the insurance company. So it's coming. It's very slow.
So, Deborah, are they finding that in your prior company, are they finding that they can make money and be profitable? I mean, really profitable, and obviously that's what a business is about. Without the insurance component.
In my previous company, we did no billing. We were paid directly by the employer, and we were paid by the employer to manage the total population. And so having a consistent provider manage a population by getting to know who you are and managing your care. When you go to a cardiologist or a GI or endocrinologist, you're getting a snapshot of your patient. And I always say that the specialists are diagnosticians, they're not caregivers. So if you give that information back to the primary care and say, I am the person who's managing your whole care, we'll bring all the components together, we're going to take care of you, and we're going to find out what's causing this. We had, when I sold the company, we had 200 different employers, and almost all of them were getting a return on investment. We were making a profit, and we were reaching probably 70 to 80% of the population and improving their health. So it was really a win-win-win for everybody. The providers loved it, the payers loved it, the patients were getting an experience beyond belief.
And then the insurance companies weren't getting as many claims.
Correct. That is exactly.
So they loved it too.
You're exactly right. You're exactly right.
That's very now. Why is Medicare doing this new program? Do you think what's motivating them?
Here's my belief. I'm guessing from the sidelines, but here's what I believe. I think when you look at the diseases that are facing Americans today, the disease that consumes the most resources over a long period of time is cognitive decline and Alzheimer's. Because if you have cancer, if you have a heart condition, they're not going to probably last 10 to 12 years with deteriorating conditions. You can have some supplements for cancer, some for heart, probably not going to have 10 or 12 years. But what happens is with cognitive decline, people become completely incapacitated.
Mm-hmm.
I believe that Medicare thinks there's not going to be enough long-term care assisted living centers. There's not going to be enough private duty for the patients. There's not going to be enough resources in the last and families are constrained by this. People are going broke by trying to support this opportunity. So I think Medicare I hope they believe this, that we have to bend the curve here. We have to do something, or we're all going to go poor trying to provide Medicare for the volumes of people who could be affected by this.
Mm-hmm. Yeah, Dr. Bredesen said $350,000 a year is what families face if their loved ones are in a care center.
Yes, it's amazing, and that's probably. I do think that they've underestimated how many people are going to have cognitive decline and Alzheimer's, and you're actually seeing it showing up in the younger years, like you're seeing with cancer and heart problems. And because a lot of times people go to the doctor by themselves, and the doctor will say, "Here's the things that are wrong," and are you having any other problems? If they're by themselves, they're going to say no. So I think we're just not capturing all of the opportunities to bend this curve on this disease.
Is it 45 million Americans a year that are currently in cognitive decline? Is that the right number?
I'm not sure I think it's around 13 million that's expected, but I'm not sure. I'll have to
Okay,
check.
I should look it up because Dr. Bredesen did say what in my podcast. You should listen to that podcast if you have a chance.
Yeah.
It's on YouTube right now. We just posted it live. So if you have I think you find it really fascinating. Today's podcast is brought to you by Qigenics. From stem cell therapy to lifestyle coaching, Qigenics is the perfect place to go for all your health and wellness needs. This health clinic is amazing at getting you personalized medicine and wellness that is unique to you. Use the code AGELESS and you'll get 20% off your first service with them. Go to www.qigenix.com to find out more information about these powerful methods. Okay, let's go backwards a little bit now and talk about gray matters. How did the concept get evolved or get defined, and what is the concept and what is the mission?
So Dr. Bredesen got pretty excited when he discovered we can turn this around if we get to the root cause, and he trained a lot of people.
2000.
Yes, he did. And so some of the people got into it and were a little bit over their heads. They were like, okay, this is not as easy as it sounds. We know the protocols, but it's going to take time. Does it really fit into my practice? I may not be able to handle all the complications with the population. So it happened to be a clinic in Sarasota, Florida, that the provider got into it and said, I have a population here, but I need somebody else to manage it. And so I had just sold my company and I had met Dr. Bredesen, and we decided, well, let's go take that population and see if we can put primary care in the center of it, managing the whole patient. Because a lot of times if you have cognitive decline or cognitive issues, you go to your primary care doctor, they send you to a neurologist or somebody else, and then you sit around and wait to decline. So putting the primary care around the center, saying a couple of things. One is, we're going to manage your total care. We want to, and Dale and I talked about this, Dr. Bress and I talked about this. We're going to manage your total care. And that's really important because a lot of times when people have cognitive decline, it's hard for them to express all of their issues that are going on with their health. Mm-hmm. So we'll find they haven't managed their diabetes. We haven't managed their hormones. They have other issues going on. And so we really try to manage the total person. And then we treat them as a holistic person, trying to manage their care. The second thing we understand is that you can't just say to the person, here's what's going on, here's why it's happening, go home. Well, it's like when you go to a conference and you learn all these things, you go back and do the same thing you've always done. Well, we stay in touch with our patients, and I call it a living care plan. Here's what's going on with you. Here's what's happening. Here's some steps that we want to start to take to turn this around. And we're going to be calling you and making sure that we're keeping touch with you to make sure your whole health is moving in that direction. We have to make it livable. People have to live their lives, but we have to make care plans for them that they can start to implement.
However, if they're in cognitive decline, they're being brought in by a caregiver.
They are, and I'll tell you what happens with the cognitive decline. The two things happened when we opened the clinic. I was a little surprised by this. So first of all, a lot of people are afraid to find out what's wrong with their brain. So we put up a sign that says brain health. Nobody wanted to come. And the people who are the hardest to come are people who are in their 60s, they just retired. They want to enjoy their life. They don't want to know that there's a potential end to it. So it was really scary for them. Plus, they believe that there's nothing that can be done. Mm-hmm. So the people who did come to us were people who had some pretty severe cognitive issues because they were tired of not being managed. They were tired of being sent home and told to decline, just do this, and you'll just continue to deteriorate. Well, when we were able to diagnose some of the patients and understand what was going on with them, we were able to do two things. One, we treated like I'm a whole person, so we were really cleaning up a lot of other health issues, but we were able to train the caregiver what to expect. So if they have different kind of things to help them manage their care more effectively, they really, really appreciated us taking care of that whole person, number one, and two, knowing how to expect things from that patient by understanding what was causing it. And when we catch people at a certain level, there's a Montreal cognitive assessment test. Mm-hmm. If we catch them at a certain level and we have the opportunity to identify what's turning them around, we have 80% of our patients are actually improving, which is significant because typically you're sent to go home to decline 1 to 3%. Well, if you even stabilize, that's an incredible thing. So I'm working with a family who has you couldn't get much lower in the cognitive decline, but the family's so grateful for that total care about, does she have a UTI? If she got her diabetes, they understood that she had diabetes, wasn't managed. She lost 20 pounds. She's actually healthier than she was. When she came to us, she had 16 medications. She's down to 7 now and feeling better. Her cognition's probably not going to come back, but it's actually that they're managing a healthier person.
Well, how do you know the cognition won't come back if all this other health issues are being addressed and even cured?
Some are just, it's been too long before they've started to get the process going. But some are, we had some really good success stories. We had a 92-year-old woman who has lost her independence, wasn't able to drive. We were able to uncover what was causing that. She's back out driving, having her home. I ran into 2 patients in our clinic the other day, and I couldn't tell which one was the difference. It was a daughter and mother. And the daughter said in September, she couldn't say her name or know who I was. Now we're arguing over who's cooking dinner. So,
That's great.
it's really wonderful. People just don't realize now. I do say this to people, and as I'm out talking to them, is that the disease actually starts, as we all know, 10 to 15 years in advance. And what happens is we're fighting those things that are attacking our bodies and our brains. And around 50, we start to slowly, we're not as healthy as we used to be. We're not fighting like we did. That's when it starts to show up, is as we get older, because those things we didn't change in our 30s, 40s, and now it shows up. So I encourage people, and I tell families, let's think about you, but let's think about your children. Let's think that we can avoid this sort of thing. So a lot of times we get families and the kids and the parents and the brothers and sisters to come get the whole testing to say what could cause me to have this decline and how do we turn it around?
No, particularly if they see one of their family members, they know genetically they may be, maybe they have the APO4 allele, the genetics that would predispose them to Alzheimer's, or at least, as Dr. Bredesen said, doesn't mean that you have a death sentence. It means you just have to work harder but if a family member already has cognitive decline, then it could very well be that it's running in the family, right?
Absolutely. And the woman that I ran into at the clinic that was arguing with her daughter, she had APOE3. And so she was understood that she was probably got a 30 to 40 chance of having that gene turned on. But she was so dynamic. It was amazing to see her come to life. And that's what we do, is we see people come to life. So it's exciting.
So tell us about the prototype of the gray matters. If you were going to one of your facilities, you have 3 facilities now, correct?
Yes.
Okay, Sarasota, and where are the other 2?
Jacksonville and Ponte Vedra.
Okay, so but plans are for what kind of expansion?
Well, right now, because with the guide program, when Medicare set up the guide program, they invited people across the country to apply for this program. 400 people applied, 97 were approved across the country to be one of those that was guide certified to start right away, and we were one of the 97.
Oh.
So there's no more people that are going to be invited into this program. So it could change. It's an 8-year program. This is what they're saying now.
Right.
So what has happened is we're having people reach out to us to be partners with them to help manage their patients, maybe in another practice, maybe in another territory. So we can come in. It allows us to have time to work with the families and the patients, but it allows the provider to hang on to their patients if they want to continue to do the primary care. So we're being asked around the country to be partners in other practices.
So does that mean you'll have bricks and mortar?
We will join in somebody's bricks and mortars, or we might continue to develop our own. I would say the other thing that's really nice about our situation is, as you know, we're in Sarasota, and it's a destination location for a lot of people. And
exactly.
So we have a lot of people who are here 7 months of the year, and they go back to Pennsylvania, Michigan, Ohio, wherever they are. We still do a lot of telehealth. We can still manage them collectively. We also have people, because of Dr. Bredesen, who knows him very well and knows that we have this clinic, call us from all over the world. We can do the telehealth from our office. So basically our process is to first do a lot of blood draws, because we know that doing whatever is in your blood is in your system.
Mm-hmm. Right.
So we do the blood test, And we get a lot of information, and then we do the cognitive tests. We have a cognitive assessment test. We have the MOCA test. We have a version of the CNS test, which is we've made it equivalent to be on the internet, so we can do that process. So we take that information, and it's a lot of information. So we really try to have 2 or 3 visits with the patient to go over what's happening with them. Sometimes it's blatantly clear that we see that there's a problem. As example, in Florida, but also in other parts of the country, the mold is a problem. Um,
Mm,
but when people think of mold, they think mold in your house or the black mold, but there's mold in your food. There's
right.
mold, in chemicals that you're taking in. So there's 5 logical molds that you can find. So we try to look at those. Those are the things that we can immediately say in the care plan. Let's try to detox mold out of your system. Some of the other things that we can see are, do they have an infection? Do they have they had a constant infection like herpes, something that stays there that's underlying the dental diseases? We've had people who've had silver in their mouth. We had a gentleman who was actually, we did all of the care telehealth wise, but we kept saying there's a problem with your dental. We think that there's and he was like, no, I got the best. Well, turned out underneath the silver filling was an abscess and infection growing.
And,
So
and no one had told him.
no one had told him. No, it's sometimes these things are hard to find, but if you do the lab test, the right lab test, you can see that there's something going on. We can figure that out. So that series is really our start to get going down the process for people. Some people may need more testing, some may need less, but it really gives us a foothold of how to manage this patient, what's going on. Could be sleep, it could be exercise, it could be, there's first responders as an example, people who are firefighters who go into chemical buildings. There's, people who work in the residential areas who are taking on some of these other, like plumbers, maybe in residentials, they're breathing this smoke, this chemicals that they're putting into the piping and whatever they're doing to mold things. So there's people who may have some risk factors who should get tested about those things. Oh, factories, a Roundup, all of those things are really, people are using aluminum, processed food, all of those things are really things that are contributing to the person's cognitive decline.
It's quite daunting though for a consumer, particularly someone who's in cognitive decline. So the family support mechanism is really critical. But even those people sometimes are very allopathic in their approach, and so you have to convert not only to a functional approach, but you have to get compliance. So it's one thing to teach them; it's quite another thing to get action. So how do you overcome those challenges?
Well, if I could tell you a limited story, there was
Yeah, go ahead.
I, I I had
That's oftentimes the best way.
I had a friend who had a mother who was in decline, and I kept going, I'm really embarrassed that you have your mother not seeing our clinic, just at least for the testing. No, we've had our primary care forever. She loves her primary care. It's wonderful. The only problem she has is blood pressure. I said, okay. But you know how people are, a lot of people will ask their neighbor before they ask their provider what's going on.
Right,
Of course, the
right.
mom had a blood pressure problem, and so they called me saying, I have a blood pressure problem. I was like, well, did you sit her up? Is she had an infection? Did she get hurt? That'll cause blood pressure to go up. Well, I don't know. And I said, well, why don't you bring her to our clinic? No, we're going to our primary care doctor. So they took her back to the primary care doctor, and they increased her blood pressure medicine.
Mm.
So we finally, and I said, well, and so the second time they called and they said, well, they're going to see her in 3 weeks. I go, three weeks. Let me get you in tomorrow. So we got her in tomorrow, and it turned out that she had a UTI that had been undetected so much that it affected her kidneys. But
Mhm.
the problem is when we got rid of the UTI, her blood pressure dropped to 90.
Oh,
She did not need to be on any of the blood pressure medicine.
oh, oh
So
no.
So because they called me again and said her blood pressure's at 95. I go, oh my gosh, that's terrible. And they go, no, you don't understand. It's now moving up because we took her off of all of those medications. She never needed to be on the blood pressure medicine. She needed to be diagnosed as a real person. And that's just sort of now they're believers. Now they're like, oh my God, you saved her life. And plus, there's all other complications going on that had not been covered. The problem is the family gets so used to seeing the same person who knows them, that and the patient was not capable of really talking about what was going
Of
on.
course, yeah.
And so it's just, those kind of experiences get people out talking and saying, wait, you should come, you should go, you need to get an assessment. Even when I was a healthcare CEO in Chicago and in Boston, I'd always say to people, you know what? I firmly believe in second opinions, even with primary care. Because if you've gone to a primary care doctor for the last 30 years, chances are they remember you as the day you came in the first 30 years. It's just a fresh look is not a bad thing. It's not harmful. It's a good thing. So I always encourage people, just go. And plus, if we do all that lab work for you, that you own that lab work. That's what's going on in your system. You should have that information. You should know what's going on. So it's just important information. And I talk to people and I encourage them, and we don't hurt them. We call it a hopeful process, not a hurtful process, and we're just trying to help. So we're getting good results.
Well, you have to be really not only a practitioner and a technically trained person to understand all the labs and all the mechanics of this, but you also have to be a teacher.
Yes. I think that's the most critical thing that primary care doctors have to do is be a teacher. I was just talking to a group of primary care doctors saying the most important thing you can do is educate your patient. Don't just treat them for the symptom or the cause. Educate, how did that happen? What caused that? People like to learn about their health, so you really have to be a teacher. And I would just say the other thing, the labs that we run, the challenge is if you ask your primary care doctor to run them, they wouldn't know how to interpret them because they don't do it all day long.
Exactly.
So they're not going to be able to know what to do with it anyway. So that's why we're good partners with some of the primary care practices. We can come in and say, here's what's happening. And we can educate them as well.
As long as they're not threatened by you. A lot of these people are extremely set in their ways because they've done it. This is the way I've always done it. This is what they taught me in medical school. I never had to take a nutrition course. You really have to be somewhat of a as patient as Job to be able to get compliance from both sides, the patient side and the primary care side.
You do. We have to be non-threatening to everybody. I think the challenge again for healthcare is that even though you may learn the greatest things in the resident school and your training, when you go out, they usually pair you up with the most senior person. The most senior person's in charge. That's why they say on average it takes about 30 years to make a change in healthcare, and it just does. And even though there's common sense out there, it is threatening to a provider to not know all the answers.
Right.
And when we can be a non-threatening partner and helping them see the patient get better, we just try to be helpful.
Do you ever do any kind of seminars or webinars or with the primary care professionals, so you get that side to get involved in a way that's educatedly involved?
We try a challenge in a lot of geographies are that the doctors are all aligned with a health system, and the health systems usually believe they have all the answers to the whole stream of services. And so if you're not part of that system, it's hard to get people together to listen to this. The other thing is providers in the traditional medical sense are a little leery of functional medicine. Part of the problem that I saw with functional medicine is, how do you know you have a good functional medicine doctor? Because we really don't have the quality assurance measures in functional medicine. So functional medicine to me in Chicago could be completely different than functional medicine to me in Boston, or even here in Florida. So there's just different pieces. Now, I would say Gray Matters fits into this because we are MDs with functional medicine, and we also take insurance. So most everything that we do to do the screening and the uncovering of what's the causes are covered by insurance, which is great.
Well, that's huge.
Yes.
Because so much resistance does come from the financial side. Well, the intellectual side is the big one, because you have to change opinions and you have to get people to change their ways, which the older people get, the harder that becomes as a challenge. But the financial side, on the other side of that, though, the argument is, well, would you rather spend $350,000 a year in for a care facility, or spend whatever your fees are to get cured?
Right.
That's really a no-brainer, no pun intended.
Yeah, you're right. It is no. Thank you.
So Deborah, why is it, in your opinion, that Alzheimer's and dementia, the let's call it the disease of Alzheimer's, has been such a abysmal failure in the medical solving the root causes or the causes and getting people to overcome this disease. As Dr. Bredesen says, very boldly, we should be the last generation that considers this as a threatening disease. It'll be like polio, is what he said. But that seems so. I mean, he's brilliant, but it seems so unreachable when you look at what's out there today. So, what's your opinion about why there's been billions of dollars spent on research and looking for cures, and every one of them has failed?
Well, I think the first problem is that they're looking at solving the problem, not the symptom.
Mm-hmm.
So they want to find a pill or prescription that's going to say you're not going to have the plaque.
Yeah, I think you meant the opposite, Deborah. You meant they're looking for a way to solve the symptom and not the problem. Am I correct?
Correct.
Yeah,
Yes.
you said the opposite, but I knew what you meant.
Yes.
Okay.
And they're solving what is causing this, which is a plaque covering the brain from the attack. They're not saying what's attacking the brain. So they're going after that. And we've been trained as Americans, I think, to think that we need a simple pill to fix everything.
Right.
And, we like immediate gratification. It's been probably in the last 10, and I hate to say it this way, but the one thing that happened with COVID is people started paying attention to their health. Everybody had to pay attention.
Mm-hmm.
Before, trying to get people to pay attention was, I have good insurance plans that'll take care of me. Well, they didn't think about their overall health. What are they eating? What are they sleeping? Are they exercising? All those sort of things. So we're starting to get people to think about their health a little more, think about that. So I think we're moving in that direction, but we're still trying to solve the symptom, not the risk. And so.
And why do you feel more women get Alzheimer's than men? Is it something to do with hormones, or?
I'm not sure I can answer that. But I do want to say one more thing that I think is a problem in this health system. If the disease has started in your 40s and 50s, right, why aren't we testing for that in our 40s and 50s? Because if you go for your physical with your provider, your primary care provider, they're going to do diabetes checks, they're going to check your cholesterol, they're going to check your heart, they're going to check all of these things. Nobody says, let's check what's affecting your brain.
Exactly.
Yeah,
yeah, and that's why, if you go for a colonoscopy, why are you not going for a cognoscopy, as Dr. Bredesen says? It just seems like it should be a part of the routine, but it just has. I mean, I have never had a doctor ask me, and I go to all the, really great functional medicine ones too, but they don't ask me to do anything with my brain unless you're going to a brain expert, like if you were seeing Anne Hathaway or, one of his Dr. Bredesen's proteges. So that does present a big issue. We treat the symptoms. We look for a pill. We want instant gratification. We don't really do as thorough a job on the lab testing to really get to the root cause. That would be some of the reasons, right?
Yes, absolutely. And I think that we haven't recognized that. And the other thing is, if we checked people in their 40s and 50s, when I had my other company, I would say to the employers, would say, well, we have 20 years old, they probably don't have bad numbers, but I'd always say that they probably have bad habits. Mm-hmm. And the habits are what's going to get them in trouble. So if we could think more about people's habits at 45 and 50, what's going to get them into trouble, we'd be able to educate people a little better. And we could change that. People don't understand. A lot of times patients don't understand that what they're doing is harmful to their health. Yeah. And I used to say to the providers all the time, the only person in the exam room who can improve their health is the patient.
That's right. That's why you have to be the CEO of your own health. If you're not doing it, no one else will do it for you. And so you have to take charge. And that means, first and foremost, education.
Absolutely. Education. But you also, there's a fine line between educating the patient and having them direct their care. A lot of times when we look at, let's say like concierge doctors or any other doctors, the patients are still calling the shots when I want to be seen, what I want taken care of. If
Yeah.
you have a primary care doctor who's saying, I know your health, I know your lifestyles, I know your risk factors,
Mm-hmm.
I'm going to be your health coach
Mm-hmm.
managing your health. You can make these choices that you want, but here's your consequences.
Mm-hmm.
And we just need more health. And we trained all of our providers in my other company to be health coaches. I didn't want the patient to have to tell her story twice and tell it to you, and then I'm going to tell it to my coach. I said, well, wait a minute. Why don't we train the providers to be the health coaches, telling you the story? I can tell you at the same time, here's what's happening. Here's what you need to do. Here's what the consequences are. And people, and I think you raised a couple of times, people like to be educated. They like to learn. And they like to know it's non-judgmental and it's respectful, and we're here to help.
Except you also mentioned the word habit. And I think changing habits
Yes,
is it's probably the most important, but it's also the most challenging of what faces you to get people to make change in their lives. I guess, it just depends on the individual and how bad it is. I find that so many people, because, I interact with so many people, and whether it's friends or colleagues or just business connections, whatever. And when you get talking about these things, and what you hear so often is that people don't react until they have a crisis.
exactly. Right. And that's why when with my other company, we tried to get people to come in, everybody to come in for established care physical. Don't wait for the crisis. Because when you've had the crisis, you can't go back from there. You've already had that catastrophic event. So it changes your whole life at that point. You don't need to have that catastrophic event. You need to learn first. So we really want people to understand, learn about your health, learn early, But the other thing I would say is, what we try to do with Gray Matters is that we give them a care plan. We know they're going to go home and go back to their lifestyle. But when the provider calls them at home in 2 days and says, how are you doing with that plan? That starts to, oh, my provider is calling me saying this is really important that I just change some of these things. And we want to change things very slowly, things that are, can you give up some of these things? Can you do some of these things? Can you change about some of these things? We're not going to tell them to change their whole world because they have to live in their world, but we're going to try to, and we're going to be by their side to say, we're going to support you. Just give it a try. We want to see. I mean, I'm actually a terrible patient myself, but having people call me and say, did you do that? I'm like, oh, actually, I guess I really care that it's important. I should think about those things. So we really try to stay in touch with our patients.
Do you actually have any psychologists or people who are trained in changing behavior? Do you have anything like that is consulting with Gray Matters?
We do have in our different territories, we have different people that we know would be good support coaches.
So
Yeah.
they don't work for you, but you can refer people.
Yeah.
So it's like you're like a distribution, like an OEM. You're creating the opportunities for people by referral.
Yeah. Yeah.
To get the help.
And appropriate referrals. Referrals, the nice thing is it's an educated patient that's going for the right reasons. So they don't have to hunt and find what's going on. They need to learn what we're trying to do. So
Yeah, like nutritionists too, or
yeah, yeah. I mean, a lot of times people are getting educated. I think the thing that we find is we have to tell them what not to eat.
yeah.
I mean, and it's hard to change people's diets, and sometimes there's food deserts and it's hard to get to the food, and there's different things going on, but trying little bits at a time, getting in the right direction is helpful.
I think one of the biggest things that, and this is just my thought, but you can challenge me on this. But it just seems like just changing the mindset from, oh, by the way, dementia or Alzheimer's is caused by beta amyloid plaque or by tau tangles or whatever, the latest and greatest reasoning is in the primary care world, in the allopathic world. But to change people's minds about what the root cause is that one of the biggest challenges that faces you?
It's very frustrating to me, and I'll tell you another story. I grew up on a farm in Nebraska, and farmers' lives are very, very hard, and money is very hard to come by. And so I had a friend call and say they want him to take the drug. Well, I said, the drug is not going to cure the person. It delays, it slows it down, but it extends the condition. It does not change it. And it was $25,000. That's a lot of money to people who have no money.
Wow.
And
And not covered by insurance?
no, not
Oh,
that time. And I was just like, that's just like selling your farm. I mean, it's just like, that's just not good.
right.
But people are fearful when you have that disease. You want anybody to help you, anybody to do it.
Exactly.
You
Yeah.
just you don't want to know the consequences. You don't know what's going to happen because you're afraid. You're scared to death. You're going to lose everything. So it's really hard to get some people to not panic. Is the problem, and it's a panic.
That's why I mentioned about the psychologist because, or psychiatrist, because you have this whole emotional component, which, attitude is one of the biggest causes of people, a bad attitude or negative attitude is one of the big causes for stagnation,
Right.
or inaction, because they're so, it's fear based.
It is, and in another case that I worked with, we knew we could help the spouse, but the partner had already given up, not going to do it.
Yeah.
And I understand the exhaustion and I understand the frustration, but uh, it's a family disease, and it's really affects everybody.
Deborah, honestly, what you're describing means that you must take on a lot of energy. How do you deal with that? How do you not get yourself to feel discouraged when you have situations like that, which you just mentioned about the caregiver giving up? How do you get yourself above all that? I know this is the same thing any doctor has to deal with is how do you get above it and not get emotionally attached? But it seems like such a challenge. Well, how do you deal with that?
Well, I think that the thing is that because we have so many successes, it's good to see that. So I, number one, feel good that I have had my eyes open that we have a problem here and we're not treating people correctly in our current systems. And to actually see people come alive again is very rewarding to me. It breaks my heart to see that. I see that person all the time and I'm just like, oh my gosh, I think we could have done something. Um, but if you can't, you can't. But those you can, and you see the difference, you're very gratifying that. And that's the other reason why I'm sort of passionate about saying, and with Dr. Bredesen as well, this is not correct that we continue down this path, the way we treat people in normal health systems. We have got to get ahead of it early. We shouldn't be dealing with this. People shouldn't be afraid of it. People should embrace it and say, this is the brain drives everything. Why aren't we paying attention to it? Why don't we do something about it? And I don't understand that. But I wouldn't have, in my former life as a healthcare CEO, I never thought about it. I just thought we're treating whatever we're supposed to do and how we do it. But now that I'm, digging into these details, I'm like, oh my gosh, I'm so embarrassed that we do these things. We could do so much better.
That's why coming on podcasts, it's like baby steps. But honestly, the more you can get out there and tell the story and reach more and more people, I know it's a very time consuming effort, and also more PR from the media that
Yeah.
helps to promote early detection and helps to promote testing, and then the patient at the end of the day can go to their primary care and say, I want this. I've read about it. This is something I want. And now the doctor has to uh, comply unless they're being completely stubborn about it. But it would just seem to me that more and more patients asking, like, why do you think so many patients have turned to supplements? Because allopathic medicine has failed them. So, and why is the Maha movement becoming so widespread and popular? Is because people know there's something wrong.
Right, right. I have to tell you that one of the reasons I started my other company was I would get patients come to me, and we had 1,100 providers, and 600,000 patients we were treating, but they'd come and say, I've done all my age specific screenings, I still don't feel well. And
Yeah,
nobody can tell me why I don't feel well.
right.
Well, nobody would answer her call.
Yes.
I'd call the cardiologist, I called all your people, nobody's answering my call. That's when I said, we're doing something terribly wrong here. And when we fix the things that are fixing the brain, when we're working on those root causes, we're actually fixing the whole body. If
Right.
people have leaky gut, they have other things that are going on. It actually is taking care of the whole system because we're taking it from the things that are traveling through your blood and affecting oxygen from getting to your brain and taking care of your whole health system. So it's really a comprehensive approach.
Yeah, and think about it, the microbiome has become the kind of darling of the functional medicine world, and it really is 90% or whatever, 70, 80%, whatever whoever you're listening to tells you that your immune system is in your gut. So why not start there? And that's why Dale was it's so refreshing, and you're so refreshing because you do focus on the whole body and saying, look, if we can fix your gut, this is just one example, but if we can fix your gut, we can probably fix your brain
Right.
because of the gut brain axis, which nobody ever really thought about. And then serotonin is made in the gut. And why do people feel depressed? And they call it, some brain disorder, but it's actually a gut disorder. If
Right.
you're not producing dopamine and serotonin and the other neuro endorphins, right?
Right, absolutely. I'll tell you, I mean, it was eye-opening for me with my other company to find out. I said that some of the patients that we treated that were the worst were people who were in the system and overtreated, and people who hadn't been to the doctor for a long time. And the problem with people who don't feel well a lot of times without knowing it and they're getting their care, they'll go see 10 different kinds of doctors and they're not getting one really good story, one assessment. They're looking for a solution. Well, people shouldn't have to look for a solution. We should be helping them find a solution.
Yes, find the causes. So let's take a deep dive into two things. One, the root causes and what some of the treatments are that you're doing, and two, the lab testing that helps you establish the baseline to find those root causes. So if you could tell us, more comprehensively what those consist of, that would be excellent.
So the labs are pretty thorough labs. I mean, there's a lot of vials of lab that comes out. So, but I can't go through all of them, but I'll tell you what we're looking for. We're looking for toxicity. Is there toxicity in the system? Is there inflammation in the system? Are we looking for mold? Are we looking for, those are probably the common ones that are happening through foods and exposures.
Mm-hmm.
And then it really becomes through other habits like um, the cognitive issue comes into the fact about are you actually stimulating your brain physically? A lot of people aren't exercising as much as they should or exercising to continue to promote the blood flow and oxygen to your brain. Are you sleeping? It's probably a bigger problem than we know that people don't sleep well. And so trying to get the testing that people understand they may have sleep apnea of some kind or they have some other kind of sleep issue. And then really getting them to start to think like as Dr. Niels, who is our chief medical officer, says, ballroom dancing, thinking and moving at the same time is really good to be able to connect all the pieces together. So
Mm-hmm.
those are sort of the things that we look for. And then when we get that information, we start to drill down. Well, why we had one woman who had a lot of toxicity and inflammation. Well, we found that she was walking her dog among all the traffic every morning and breathing in all of these fumes from the cars or living from that capacity. Or, so we then try to drill down and say, well, why is this happening? Are these things what are you exposed to now? So we can kind of drill that. Then we'll try to detox that and say, let's first of all get you out in the environment or in the environment or help with your sleep or help with your food. And then we continue to retest that process.
Mm-hmm. So for the food test, do you do food allergy tests?
We can if we find out that a lot of people do know their allergies already by the time they come to us, but there may be some things that they don't know about. So we can if we don't get to the solution in the first series of lab tests and everything, we continue to drill down and say there's more tests that need to be done. But we try to do the first screening and then we try to drill into something that may be lingering there that we haven't been able to identify.
So are your scans the same scans that Apollo Health uses with the the p-tau 217 and the NBA or whatever, the
We do.
GFAB, I think it's called. Those three components. Is that the same test that you use?
We actually have we have those, but we have more and some more enhanced ones as well.
Okay, so if someone wants to, I'm just thinking about, our viewers. If someone wants to go through this program, what would the steps be?
They would we have a website, graymattershealth.org. Frankly, if you go to the graymattershealth.org, there's a little test right on the screen that you can say, I want to take a little cognitive test there, and it'll do a mini Montreal cognitive assessment test.
Oh,
But if you wanted to have a free session of really what we would do wherever you live, they can call in, we can get an appointment, and we'll walk you through. You live here, here's what we'd want to do, here's how the screening would work, and be able to set people up if they want to get started.
and would the first step be that the test, the bigger scan?
It would be the bigger process, the bigger lab test if we do that screening, yes.
Okay, and so how much does it cost for someone to take that first step with Gray Matters?
If the labs are covered, the total screening cost, if we were doing it and they had no insurance coverage, it'd be about $2,500.
Okay, and what if they do have insurance?
If they do have insurance, it's probably going to cost about $300, $250.
Well, that's a huge difference.
It is. It is. But I would also say this, like you said earlier, $2,500 or $350,000.
Yeah.
And frankly, the $2,500, it's your information that you need to know about. It's good information. I mean, it's good for you.
So does Medicare cover that first screen?
Yes, they do.
Okay. So if someone calls you and has Medicare, because probably, unfortunately, the 40 and 50-year-olds are not usually taking these steps yet. This is going to be the process that you're challenged in, that includes the younger generation. But let's just say they already have Medicare. So they call up. First, they take the little test on the website.
They don't have to take that, but they can. It's helpful to them. But
yeah, just to get an idea. And by the way, they don't have to have issues or symptoms to call to. In fact, that's what you're encouraging.
Right.
Because 20 years before you're going to show any signs of dementia, you are actually you could actually start having the symptoms, but you just don't feel it.
Correct.
So that's why Dr. Bredesen said at 40 years old, people should start contacting you. So, okay, let's just say it's a healthy person, but they're 60 years old or 65 because they have Medicare. So now they get covered so that you send them to a lab, you send them the requisition.
So let me just make one clarification. If they have insurances like we have Blue Cross Blue Shield or Florida in their 40s and 50s, a lot of times the labs will be covered, so that takes $600 off of that fee.
Oh, okay, good. I'm glad you said that.
So I also want to add a clarification. Advantage plans are not covered.
Okay.
Because they've already got a primary care. I think the government looks at them and says, we're already supplementing them already. And so they're not covered at the moment. But there's a push to try to get them in because it's going to reduce all the costs of the Advantage plan for people.
That's true. Sometimes they don't connect the dots.
They don't. So somebody calls in. If they're going to go in the guide program, then all of that's covered, 100%. If they're Medicare and they aren't going into the guide program, but they want that screening, they would pay probably the $350. Everything else would be covered.
But didn't you say that guides program is capped off at already, that it's closed?
No. We know that the eligible providers are.
Oh, okay. So how does one, if you're on Medicare, how does one get enrolled in that program?
We enroll you. If you want to be part of it, we can enroll you.
And that's at no cost to the patient?
No cost.
Well, then why wouldn't you do that if then you get everything for free?
Yeah, plus we coordinate if it's a Medicare program and they're coordinated and they want some respite care, the government will give them $2,500 for respite care for like adult daycare center or some private duty. We help coordinate if they need Meals on Wheels or any kind of transportation issues. It's a full coordinated package if they want it. A lot of people are just happy to have the care given and assessment and understanding their patient. But yes, it's 100% covered.
Debra, what I want to encourage today on this podcast is people who are not feeling any symptoms, people who are feeling extremely healthy and fit. And, that's really our demographic anyway. Most of them, people that watch this podcast are people who are feeling fine but want to feel better or want to stay that way. So it's a lifespan and health span. So I'm just encouraging people, don't feel that you have to have a symptom in order to contact Debra.
Right, right. I think that people are a little bit nervous. They should contact us. They want to stay healthy longer. Like you're saying, longevity is the key. We want to be healthy, but we want to be functioning and we want to be able to maintain our independence. So come get tested because there may be some things that make you feel better. A lot of times patients don't know how good they can feel when they feel better.
Mm-hmm.
So we really try to work through all that process. And I think I would also say to parents in their 60s, have your kids go. So encourage your whole family to go. We've had a family come down that brought all 15 of their family members and said, we
Oh,
all want to know. Yeah, so,
oh, that's amazing.
yeah,
And the other great thing is this can all be done by telehealth. So you don't have to live in Sarasota or the other two cities in order to get the treatments here. So this is the value of Zoom calls like what we're on right now, right? Do you assign a particular practitioner to each patient, and that patient's like a concierge
yeah,
doctor?
you do. We
Okay.
have, I would say, yeah, our practitioner here in Florida has dedicated totally on cognitive health, does some primary care. In Jacksonville, we do a lot of primary care with cognitive health, a little bit opposite, but the results in getting started and getting identification early are amazing. You can really have a long, independent life if you want to have that.
And do you advocate supplements over pharmaceutical drugs when you're dealing with patients, or how do you walk that line?
Well, if there are supplements, and even normal providers are going to give you vitamin D. Sometimes they overdo that, right? Or vitamin B. If there is a lack somewhere for somebody and it could be supported by supplements, we do that. We don't make our money off of supplements. So,
Right.
so we really try to say, here's an alternative for you if you want that. We also already get to medications either, but we try to think lifestyle is better if you don't have to do medications. So,
Mhm.
so we really try to determine it by each individual.
I bet you have to wean people off of existing drugs, though. That's one of your big challenges is how do you do that without having repercussions?
Well, I think once they find out that, like that person who had 16 is now down to 7, they've never been healthier. I mean, they feel better. If you take a lot of medications, you're not feeling all that great for the
That's
most part,
right. Yeah, I'm a big advocate of supplements, but in with discretion.
Right,
Don't
exactly.
overdo it. But I was listening to Gary Brecka. I don't know if you know him, but he's a big biohacker, and he was just saying, there are like 5 supplements that everybody should take. Even if you don't think you need a supplement, you should take this, and that would be vitamin D3 with K2, because obviously they're like the twin. They're twins, and you don't want one without the other. So D3, K2, and in the right form, of course, and then fish oils, but the ones with low mercury. So that has to be, again, there's so much discernment that has to go on with these, right?
Right,
And then, well, he said B complex, but methylated. Because he said, the methylate, a lot of people have the MTHFR gene that they cannot methylate. And so he advocates the methylation process. This is really important for a lot of Alzheimer's
right.
patients too.
Yeah,
And then within the methylated multivitamin, there's usually a B complex, but
right.
always to find it methylated. So, well, those were the 3 big ones that I remember. I can't remember what else he said, but
Yeah,
anyway, so yeah, so I mean, if you just had a baseline that everybody could just get on,
right,
uh, even if they don't necessarily need it, it's replenishing what they already have, or in increasing the
right.
value of what they already have.
And those
So
are the ones that I'm on. So
yeah, oh good. Well, me too.
yeah.
Me too. and a lot of others. Then, because he did say, well, yeah, then if you want to get to the next level, you might go on NMN or resveratrol or, some of the adaptogens like ashwagandha, things that gets to another level. But I wouldn't ever, in your position, want to confuse anybody
Right.
with those until they did the testing, and there might be a really big need for
Right.
something.
Right.
Well, they just signaled me that we're unfortunately at the end of our 1 hour time, which it goes so fast, I swear. I always think when I see that little 5 minutes left come up, I think, how did that go by so fast? But thank you, Debra. You've been absolutely lovely. Is there anything, I know I do, before we go, want to tell people that you've offered an incredibly wonderful gift for our viewers. So why don't you tell us what that would be?
So if there was somebody who would like to come in and we could orchestrate a MOCA test, we'd be happy to do that.
And so just tell them how they would do it.
They can say they had this podcast and they would like to call that number, and we'll be able to do that for them.
Okay, so that number is?
It's on the website.
Oh, okay.
Yeah,
Sorry.
I just go to the website.
That's all right. We'll put it on the show notes.
Okay.
So it'll be easy for people. And it will be, basically, it's a basic preliminary scan.
Yes. Yeah.
And you'll then interpret it and then guide people. And how long does that take to do that?
Not more than 20 or 30 minutes.
Oh, perfect. Oh, if anybody doesn't take you up on that offer, I'd be shocked. But just use the code ageless when they call.
Yes.
Okay, everybody listening and watching, make sure you use the ageless code, and we'll give you the website, the telephone number to call, and you'll probably hear from some of our people. Is there any one message that you want to leave with us today, Debra, before we part?
I just want to say we are really here. We're a hopeful, helpful process. This is something that people should learn and know about themselves. It's always, all it's going to do is add to your knowledge about your health.
Right. Take responsibility for your own welfare.
Yes.
Very good. All right. Well, you have a beautiful weekend, and thank you so much for all your guidance and your insights and that incredibly valuable experience that you've had, and the understanding of people. That's what I picked up today from you, that you have a sensitivity, that you want to help. You really have the wonderful, value that so many people in the wellness world need to have, which is you really want to help people to get better.
You do. Really do. Thank you so much for your time.
Okay. So good to meet you. Thank you, Debra.
Thanks.
Okay. Bye-bye.